Welcome to my world. Another day, another time for knowledge acquisition. Today, I shall be spreading it onto fungal infection. The topic title is Understanding Fungal Tests. Fungal infection is very common, especially with those who are immunocompromised, those whose hygiene are not something to write home about. But generally, fungal infection does not cause serious or fatal problem. But when in immunocompromised people, you can experience serious problem, even as far as death, especially these days that we have AIDS patients, HIV/AIDS patients, people who are not well fed, we have malnourished people and all the stuff like that. So the health level is also a problem. So we need to look at fungal as one of the diseases that could also create more problem for those who are immunocompromised and those who are not healthy. It does not necessarily mean that those who are healthy too are above it, because your hygiene level is very necessary. So today I want to look at those tests. Let us understand why we do these tests for fungal diseases, and let us know more so that we can help in stopping the spread of fungal infection. Understanding fungal test is very important if we must appreciate the work of the laboratory, and it has so many parameters. These areas that are very necessary is what I shall be exposing in the slide section. So if you like what you're looking at, press the like button, subscribe, and yes, the program will continue to be more and more interesting. Understanding fungal tests. Outline: objective introduction, principle of test, fungal test, conclusions. Objective: to expose the principle of fungal tests in order for patients to cooperate with investigators of the various tests done to eradicate fungal infections. Introduction: according to WHO recommendations, strategies to reduce the global burden of fungal diseases include the improved surveillance of fungal diseases necessitating affordable access to diagnostic tools. The diagnostic tools are the conventional tests done to diagnose the diseases like ringworm, dermatophytosis, a group of fungi that live off skin, hair, and nail cells. Dermatophyte cause ringworm, and they are called Tinea capitis caporis. Onychomycosis and candidiasis are all part of it. Test principle: fungal infections affect the superficial, subcutaneous, and some internal organs and systems of the body. The superficial skin, hair, and nail tissues are collected for microscopy and culture, that is under mycology, when you do the study of fungi, to establish or confirm the diagnosis of a fungal infection as different from bacterial skin infection. Exposing the site to long wavelength ultraviolet radiation, called wood lamps, can help identify some fungal infection of hair called Tinea capitis. The body horn is called Tinea corporis because the infected hair or skin fluoresces green, and that is diagnostic. The macroscopic feature of their growth culturally views their colonies' characteristics, growth rate, color, texture, diffusible pigments, when you see the colors, exudates area, and submerged hyphae are useful in differentiating them, and therefore the drug to use is very important. The microscopy also separates the hyphae, the ones that are separated, that is the cells separated. You can look at this picture, you will see the hyphae, that is the one in nucleus separated and the one below not separated. So the septate hyphae and the one below is called non-septate hyphae because the nucleus is not separated by cell separation. Fungal tests, macroscopic and symptom. A fungal infection on the skin may cause redness, itching, flaking, and swelling, itching. itching, soreness, redness, or rash in the affected areas, discolored, thick or cracked nails, pains while eating, loss of taste, or white patches in mouth or throat. The white patches are at times they call thrush, white patches of candidiasis, a painless lump under your skin. Infection in the lungs may cause coughing, fever, chest pain, and muscle aches. These can be as a result of aspergillosis or other systemic fungal infection. Wood lamp is a lamp that emits long wavelength radiation, and as earlier said, that fluorescence will bring out the organism. Microscopy. Take a tool to scrap and remove some of the affected skin lesion. It's called skin scraping. Place the skin scraping into a liquid containing potassium hydroxide, which will destroy all cells that are not fungal cells. Next, examine under the microscope. You can use dyes like Indian ink, lactophenol, cotton blue, and even things that will fluoresce out. This is the typical cells of the big one are the chlamydospore and the hyphae are those looking like branches. This is the cultural appearance. You can see to the far left is Candida albicans, always looking cream-like. The trichophantom, dermatophytes. The Aspergillus fumigatus are the ones that you find in the lungs causing cough, systemic problems that you use their appearances. Like I said, the colonial appearance. If these are coming out, you can see them. Probably they are dry. The ones with that we call trichophantom, you can see the pigmentation coming out red. Non-cultural method involves serology, antibody detection, antigen detection, immunohistochemistry, and on. Molecular method, you can use polymerase chain reaction to multiply and get that helps a lot, and microarray. It helps a lot in multiplying them. Conclusion. There is no way we can conclude without a mention of the risk factors that predisposes one to fungal infection, namely their gender. Men are more prone than women, especially when you talk of jock itch, which is called comobustop in my local language. Overweight people have more skin folds. The obese people especially, which are the best climate for fungal infection. When you spread profusely all the time and you don't pave the way, dry it, it allows fungals to grow. Teenagers are more likely to develop fungal infections. So wearing tight clothing and underwear trap moisture, especially these days, skin tight dressing against skin and create a prime environment for fungus to grow. Weak immune systems are more likely to develop fungal infection. People with diabetes are more prone to skin infection and especially your itch. So please tune on to all that channel, all videos on my channel for watching.